this time we're going to have ask Dr.
We
Silvernail.
have Dr. Silvernail and Dr. Linker. I think Dr. Silvernail is going to give the first report on behalf of Pitt County Public Health. And Dr. Linker, any comments he might want to make on behalf of the Pitt County School System and how this event may be affecting them.
I want to thank you, Dr. Silvernail, for coming up, because this is a concern that has been plaguing the whole nation. Particularly, commission's been having some questions about the impact of North Carolina and Pitt County. Some say stop going to church because it's a large crowd. Some are saying that the school environment has been impacted, Dr. Linker. So we certainly want to hear from you to see where we stand and some of the precautions that we need to take if necessary. Thank you very much for your presentation.
Good morning, Mr. Chairman, fellow commissioners. At the manager's request, I prepared the briefing for you this morning. We had a long discussion in our department heads meeting last week, and much of this material was discussed there as well. So first of all, for COVID-19, COVID-19 is what we call a novel coronavirus. It's an emerging infection, which means it arose rapidly. It was first recognized in China in late December of 2019. While the majority of COVID cases remain in China, the virus has spread to many countries. I want to say that that's north of 85 now. It's hard, every time you look at the tracker, it seems like it's been tested somewhere else. There was even a report of a dog testing positive for coronavirus. He or she was not that ill, though. It was an asymptomatic infection in the dog. This is a dynamic and rapidly changing situation, and some of the information I'm about to present to you is going to be outdated very quickly. So first of all, what are coronaviruses? Coronaviruses represent a large group of viruses that produce both human and animal disease. Human coronaviruses produce upper and lower respiratory tract infections, things that we would think of as our typical winter cold, bronchitis, and rarely pneumonia. And there's another group of poorly characterized coronavirus particles that produce gastroenteritis or diarrheal illness in people. A novel coronavirus is a newly evolved virus to which humans have little or no immunity. In the case of COVID-19, an animal virus became able to infect humans. COVID-19 is the third coronavirus that has been able to make the jump to humans, the other two being SARS and MERS, which happened earlier in the 21st century here in the earlier 2000s. Coronavirus is believed to have made the jump from bats to people. It's been presented that its genetics match the bat coronavirus family. This slide is an attempt to try to show you why these things are so scary. So for a minute, I want you to think that you're down at the river or maybe down at the beach and it's high tide. And there's a rock or a piling, and we can't see the top of that rock or the piling because the tide is over that. When a novel infection emerges, the first thing we see are the deaths. So we see a group of folks who get diagnosed and recognize that they have a new infection, and those are the folks who die of that infection. As the tide goes out a little bit, we see the folks that get hospitalized. And then we see the folks that are sick enough to seek medical care, but not necessarily sick enough to end up in the hospital. And then there's a large burden of disease that is mildly symptomatic or asymptomatic, and oftentimes we don't know how big that body of disease is in these infections because they are so new. We're seeing the sickest people first. So there's a bit of a selection bias in what we see, and that makes the numbers initially look much worse than they really are once we get the full spectrum of the disease known. So if you can think about that, like say a pyramid, deaths first, hospitalizations, sick enough to seek care, and then a bunch of folks who have mild or asymptomatic illness that move in our, through the community. And probably with this infection, 80% of folks are in that mild to asymptomatic range. The challenges of these infections include that there's usually little or no experience in treating the infection in the medical community. There are often limited diagnostic capabilities, and there's been trouble or not a great availability of testing for this. First, it was just at the CDC. It's been pushed out to the state labs. On Friday, LabCorp released a testing platform which was FDA approved and can now be run through LabCorp which will help improve the number of folks or increase the number of folks who can be tested. So early on, there's often no test or a very limited ability to test for these novel infections. Many times there are limited treatment options, meaning that we don't have effective antibiotics or antiviral agents to treat these infections, and oftentimes there is no vaccine for these infections, again, because they are new to humankind. Specifics right now, and again, these numbers are a little bit dated from when we put the slides together on Friday. As of Friday, there were 100,347 cases. There were 233 cases in the U.S. This morning, when I looked before I came into the commissioners' meeting, there were 111,321 cases in the world, and in the U.S., 564 cases per the Johns Hopkins tracker. CDC has only been updating their case counts about 3 times a week, so we've returned to other sources. There have been 2 cases diagnosed in North Carolina, one in the Triangle area, and then one in Chatham County that was released on Friday. To date, we have no cases in Pitt County. I know there's been some rumors circulating that there have been cases in Pitt County. This is a mandatory reportable disease. You have to report it to public health authorities, and we have no reports of cases being diagnosed in the county. The deaths as of Friday, there were 3,400, a little over 3,400 deaths. This morning, that number is 3,892. In the U.S., we are at 22 deaths by one source, and I want to say 24 by another, so in the low 20s. So that sounds scary. Anytime we hear that citizens are dying, that scares us, and especially when it's a new infection that we don't know a lot about, that scares us. But to put that in perspective, for this flu season, we've had 32 million cases of influenza in the United States. That resulted in 310,000 hospitalizations, not on the slide, approximately 18,000 U.S. deaths, including 125 pediatric deaths. So more than almost 6 times the number of folks this season have died of influenza just in the U.S. as have died around the world from COVID-19. How can we protect ourselves? Let me say there is some good news in this. Most individuals will suffer only a mild to moderate illness with this infection, and that probably represents about 80% of people. We have great experience in treating a virus with similar infectivity, that being influenza. So it's not all gloom and doom. But the other things that we can do to help protect ourselves: hygiene, isolation, quarantine, and what's known as social distancing. Hygiene, been a lot of talk about the hand sanitizers sold out. Well, soap and water works just fine to remove this virus from your hands. While sanitizers are convenient, they're not a must-have. Soap and water will destroy this virus if you just wash your hands with some soap and water. Covering coughs and sneezes, sneezing or coughing into your elbow, using a handkerchief or tissue or something else to cover that cough so that you're not spreading the droplets. We believe that this is mostly spread by respiratory droplets. And to avoid touching your eyes, nose, and mouth until you have washed your hands, so as not to inoculate yourself with the virus should it be on your hands. And I've added stop smoking and stop or vaping, because when you smoke or vape, you constantly irritate your respiratory system, and that makes it easier for infections to invade your respiratory system. Isolation. The definition of isolation is the separation of infected persons from others during the period of communicability. So for this, we would isolate known or suspected cases. For mild cases, those folks could be isolated at home. In the hospital, those folks would likely be isolated in an airborne isolation room just for additional protection. Quarantine is the limitation of freedom of movement of persons who are suspected to have been exposed to an infectious agent. Quarantine lasts as long as the usual incubation period of the infectious agent. Initially, a quarantine order can be issued for 30 days, up to 30 days, but we would use the least amount of days required, and in the case of COVID-19, that would be 14 days is the quarantine period after exposure. It can be extended by court order if it were to go beyond 30 days for some reason. Social distancing. This might include things like closing schools, churches, movie theaters, restaurants, other places of public assembly, perhaps allowing employees to work from home, reconsidering the use of sick time, and allowances during the outbreak so that sick employees could stay at home. Many employees are kind of on that bubble of not having a lot of paid time off banked, and may choose to come into work when they are sick, even if they shouldn't. So some things like that could be reconsidered. Those would not be my decisions. Those would be the employer's decision. And we didn't put it on here. When we talk about droplet spread, we usually talk about 4 to 6 feet. So we're all sitting closer than 4 feet together in the room here, so we're not doing a good job of that. But we're sometimes limited by the physical space that we're in, and that's where some of these other ideas come from in terms of keeping groups from forming and being so close. We did, gosh, the days kind of blend together. We have stood up a dedicated page for coronavirus on the Public Health Department's website, and that link is shown for you. The next slide provides a glimpse of what that looked like at the time the slides were prepared. Again, the case counts would be out of date. And I'm happy to entertain any questions or comments, discussion that you all might have.
I have a question.
Sure.
There was a statement in the national news this morning talking about a center for those who may, setting up a center for those who may have symptoms of the coronavirus. Mm-hmm. At what point does that take place?
I'm not sure
Or
what
is it a real situation?
I did not see that in the news, Commissioner. I'm not sure exactly what they were talking about. It may be appropriate to set up some sort of alternate care site for people who wanted to come in and just get coronavirus testing. I don't know that we're there yet because, again, we have no cases in Pitt County, and we do not believe that we have community transmission in North Carolina at this time.
Well, it came up when they were talking about the healthcare professionals getting sick, mm-hmm. and that at some point that should be an option. Mm-hmm. But I know it's sort of new, perhaps, but mm-hmm. I was wondering the element of how soon or what.
Sometimes with any infection, the hospital environment can become a magnifier or an amplifier for that infection. So for healthcare workers, we would want them to wear appropriate personal protective equipment, mask, gowns, eye protection, things like that while they're treating these patients. If there was no break in their protective ensemble, and if they removed it properly without contaminating themselves, and generally we do this as a monitoring. If you're the person wearing the gear, you put your gear on, you do the patient care, and now we have somebody monitor you take that off so that you don't inadvertently contaminate yourself. So as long as there was no break in that technique, we would not consider those folks exposed. We would monitor them, but we wouldn't force them into quarantine. We'd very quickly deplete our healthcare resources if we did that. If there was a break in that personal protective equipment or some exposure, then we would take those folks off duty and quarantine them. Does that kind of answer your question?
Yes, I was concerned because I have a lot of family members in healthcare.
Mm-hmm. Yeah, and again, the reassuring thing is that most of us, if you're less than the age of 60 and in good health, the virus would probably only produce a mild to moderate illness in those folks. Most of the deaths with this have been in folks over the age of 60 and with underlying medical problems.
Commissioner Nunn?
Thank you,
Yes, sir.
Mr. Chair. Thank you, Dr. Silvernail, for coming today. How are we doing on readiness for testing in Pitt County? Availability of test kits, just preparedness?
The state health department would provide each local health department with 3 test kits. It is a common respiratory virus isolate kit as far as we can tell. So we have a number of those in stock at the health department. We generally don't do acute care for people, but if it reaches the point, we may be able to set up something where we could be swabbing folks if we needed to. As far as the hospital, I believe they have adequate supplies of the respiratory pathogens test kits and would be able to collect it and process it.
I guess one more follow-up question. Obviously, COVID, hopefully this doesn't become a huge issue here in Pitt County, but just looking out in the future for preparedness for similar events, what steps is our health department taking to make sure that we're coordinating with our regional health partners and our regional municipalities to make sure that we have good communications in the event that we do have a severe crisis.
We discussed issues internally at our department heads meeting last week. I've spoken with the emergency management director several times. I have a meeting this Thursday with the local health directors from Region 10, and I'm sure this will be a big point of discussion on Thursday. I am on numerous conference calls with the state and the CDC to put as much information as I can into my head about the situation. We reviewed and updated our isolation and quarantine plan, and I have our pandemic influenza plan, which would be a model for any infectious disease that I'm in the process of reviewing at this time.
Can I ask one follow-up question? On that website, will it have the cases for Pitt County showing up on a daily basis or whenever? So that people,
If we were to have
so that
cases,
we
yes,
can-
we would post cases on there.
Okay, because
Sure.
we want to cut down the spread of gossip.
Ms. Clausen?
Unfortunately, several months ago, I had to take my wife to the emergency room. That was a god-awful experience. It was overcrowded. We were 100 and I think 12 in the line, and it was just terrible. From your perspective, is the hospital able to handle this, and are they prepared? But a follow-up with that is I heard on the national news that if you think you might have the disease or the symptoms, don't go to an emergency room. So where do you go if you don't go to an emergency room?
Yeah, I guess the first part of it is if you're sick enough to go to the emergency room, by all means, go to the emergency room. The vast majority of folks will probably have a mild to moderate illness and could be effectively managed at home. As to the hospital, I don't speak for the hospital. I do believe they are prepared to handle these types of situations. They have a plan for the mass influx of infected patients, and I believe they have implemented that, but I cannot speak for the hospital
So what if
directly.
you have a family member that has lost 50% of their lung capacity due to emphysema? They are definitely on the list, being elderly and underlying condition. After going to the hospital, if anybody in there has it, everybody's going to get it from what I could tell. I mean, it was a mess. So where would this person go? What would they do if they didn't go to the emergency room, but they have this underlying health issue?
They should probably talk to their personal physician and see if they can be treated as an outpatient. If they are, again, having trouble breathing, if they're short of breath, if their oxygen levels are low, then they would need to seek care through the emergency department for that.
All right, thank you.
You're welcome.
Dr. Silvernail, what is the difference from this coronavirus than just a common flu? And without testing, could we see the actual difference?
I'm not sure I understand the question.
The coronavirus, what's the difference of this than a common flu? Because I understand the symptoms are similar.
Yeah, that's been the bane. That is the bane of medicine, Mr. Chairman, that many viral illnesses initially look very similar in terms of their presentation. The folks who have seen these cases and reported out on these cases report that fever, cough, and shortness of breath seem to be the hallmarks of the coronavirus. The coronavirus and influenza are in different families of viruses. Influenza, when it presents in adults, is generally a very abrupt onset. It presents with high fever, sore throat, cough, shaking chills, and intense body aches. And those patients usually can come into the office and tell you exactly when it started. And they'll come in and they'll say, Doc, at 10 o'clock on Tuesday night, I just had this shaking chill, I got a sore throat, I started coughing, and I felt like I was hit by a truck. The body aches are not part of the coronavirus syndrome, and would more likely mean an influenza infection in folks. So there's some historical hallmarks that patients will tell you that might cue you as the clinician that it is one infection versus the other. We have good rapid testing for influenza. that is done in almost every office, be that an urgent care, the ED, or a primary care physician's office. That may be an immunoassay, or it may be a molecular or genetic assay for that infection, and that's another way that we can separate that. The hospital lab runs a respiratory panel that covers 12 common viral respiratory illnesses that we see in the community here. Many folks who present to the hospital with some sort of respiratory illness are tested by that panel to see if it is one of those more common pathogens. If that is negative, then now with COVID-19 around, they may very well go ahead and request the COVID-19 testing as well. Does that help?
John, do we know where and how did this virus originate?
That is unclear. We know it emerged in Wuhan, China, a city of 11 million folks. The population density in Wuhan is calculated to be 3,200 folks, 3,200 people per square mile. In Pitt County, I believe we're about 258 people per square mile, so far less dense population than it emerged in. I know there are some conspiracy theories out there about where the virus may have come from. I do not want to give them credence as your public health director, and would prefer that history resolve that issue. From the genetics of the virus, it appears as though the virus was derived from bats and was able to make the jump to people.
Yes, sir.
Sure. I'd like to follow up with Commissioner Colson's line of inquiry here. And obviously, you don't speak for Vidant Medical Center, but I wonder if it wouldn't be possible for our county page to have a formalized statement about what Vidant's standard operating procedure is going to be in the event that someone's exhibiting symptoms, so obviously getting most information out in front of as many people as possible is probably the best. We've heard, I think, a lot of us in the news about some hospitals setting up separate ways for folks that are experiencing symptoms to access the hospital outside of the emergency department. From what I'm hearing from you is that you haven't heard from Vidant Medical Center that they've established those procedures, or at least it hasn't been communicated to you. That's, I think, a problem, something that we need to make sure that we're getting out in front of. And I think Commissioner Colson's inquiry brings up that point. Where do you go? And if we can get that information from Vidant out in front of our constituents, I think that'd be really helpful.
Yep. I'm happy to reach out to them, and if they had something they would like us to add to the webpage, we can do that. Dr. Ramsey, who's both the chairman of the Board of Health and then the medical director of infection control at the hospital, he and I have spoken several times every day since this has started, in multiple emails. So we are back and forth in communication every day. During the workday and after hours as well. Do not sit on that Vidant committee at this time. I have offered to do that. We have had some joint messaging to providers through the chief of staff email list service to get messages out to physicians that have been jointly approved by the chief of staff, myself, and Dr. Ramsey.
Okay. If there's no other questions,
Mr. Chairman, can I just make two comments? Our website page on this issue has been the second most visited page on our website, and it's the #1 searched for this topic as well. So the public is looking at this page and would invite them and ask them to continue looking at it. And also in terms of the facilities of Pitt County government, we have asked our contractor ECVC to take extra care in wiping things down, surfaces, doorknobs, and so forth. So just for the board's information and our employee base.
I might mention to you, commissioners, just in case you missed it, we did put out a written statement to the public last week regarding this, trying to allay some fears, and then did a group press conference that afternoon as well with local media to try and answer questions and allay some of the fears in our community.
thank you very much for your presentation. I'm going to ask Dr. Lincoln if he would come forward and